Jay Elberg. I'm a cardiologist and head of cardiovascular development at Stanford. There are two things that I think really stand out for me here at ESC. One has been the opportunity to see the presentation here of Odyssey Escape, which we think is an important clinical trial demonstrating the ability of Praluent to lower LDL in patients who had previously required apheresis. And even more important, was able to reduce the need for apheresis in almost all patients and actually eliminate the need for apheresis, actually in the majority. And the other thing is, of course, the ESC guidelines on lipid treatments in patients. I think these are very, very important events here at ESC. Well, ESC is really it's the biggest conference in cardiology in the world. And really so much groundbreaking work is presented at ESC every year. It's hard to choose. There are many areas of cardiovascular research and development and implementation that I'm interested in. Focusing, of course, on lipidology and cardiovascular outcomes, heart failure trials, the interplay with diabetes are all important topics that I focus on here at ESC. Well, of course, there's the Odyssey Escape trial that I described. But of course, the ESC is a great opportunity for us to meet with investigators and other physicians, and specifically those involved in our outcome trial, Odyssey Outcomes, which is well underway. And it's a great opportunity to have interactions with physicians about their general experience with Praluent as well. ESC is where the research in cardiology and the development in cardiology is unveiled. This is one of the most important venues in the world for the research and development to actually be presented. And so this is where you learn about what the future of cardiology is going to be. And it's your opportunity to get key insights there as to how you can apply it to your own research and development in your own practice, or how you can actually apply this to your patients going forward. Well, I don't think we've actually seen too many surprises at ESC, but just continued advancement in cardiovascular research. We're, of course, incredibly pleased and proud of the results of the Odyssey Escape trial demonstrating the great ability of Praluent to reduce LDL in the highest of risk patients, those who require the mechanical reduction of LDL by apheresis. And the ability of Praluent to eliminate the need for apheresis in the majority of patients and reduce the burden in all patients has been really incredibly personally and professionally satisfying. Oh my goodness, you need to be organized and have good shoes because there's so much that's happening here. But your opportunity to network with your colleagues in cardiology and cardiovascular research is incredibly important because nobody can actually attend all of the important sessions that happen all the time here.